That was
Magic
pretty cool. Love chroma key. All right, today we're talking hemorrhoids. It is a condition that an estimated 50% of Americans suffer from, but most people either tolerate the problem or are just too frightened by the thought of surgery.
Or they just don't want to talk about it. But this morning we're talking about the problem with Dr. Peel, ready to give us some answers to a lot of people's questions. Thanks for joining us. First of all, tell us what hemorrhoids are for people that may not know.
Hemorrhoids are natural occurring tissue in our bottom. And everyone has hemorrhoids. Did you know that?
Everyone.
Everyone has hemorrhoids.
Some
it's just
obviously way worse than others.
Some people have hemorrhoids that are inflamed, and
Yep.
the blood vessels become engorged and inflamed because of either constipation, hereditary, lots of standing, lots of straining, pregnancy, obesity, etc. So, did you know that hemorrhoids is the most common health condition searched on Google?
Oh,
Really?
wow.
Yes.
Is that because people don't want to talk about it?
They
They
don't
just
wanna
want to
tell
look
the
it up
We know that
themselves?
50% of Americans struggle with this disease,
yeah,
and
it affects
it's
so many
a
people.
disease. And a lot of my patients struggle to actually articulate the fact that, look, one, I have hemorrhoids, and two, I have a problem. And there is treatment for hemorrhoids. So
Now, when do you know if you need just something over the counter, something you can get at the grocery store, or something you need to talk to your doctor
Well,
about?
the first thing is to understand is that there are hemorrhoids on the outside that are usually painful and can become thrombosed, and there are hemorrhoids on the inside which are called internal hemorrhoids, and those are the ones that aren't as painful but bleed a lot. And there are different treatments for both of them. For the external hemorrhoids, certainly topical therapy is the #1 choice, though sometimes we have to open that hemorrhoid up if there's a clot.
Right.
For the internal hemorrhoids, this is the condition that plagues many, many Americans, is that the old way was to essentially cut everything out or band it or inject it. The new way is called a THD procedure. It's called transanal hemorrhoidal dearterialization, where we actually go in through the bottom and very specifically find the blood vessels that lead into those hemorrhoids and sew those blood vessels off, so that essentially the hemorrhoids die on the vine and they are basically sewn up inside. Again, other treatments are rubber band ligation, sclerotherapy, infrared coagulation, and then the old hemorrhoidectomy, where we basically just cut everything out and sew things back together. That was fraught with complications. It continues to be lots of pain. It required hospitalization usually. But the THD procedure, this is a very innovative procedure that is gaining popularity across the country because it does require hospitalization, but it's an outpatient surgery. So you go home, you are able to get back to work quickly. This is a graphic that you can see. Essentially, in the operating room, we're using this device that will find the specific blood vessel within the rectum, and once we find that specific blood vessel, then we go ahead and sew that off, so that the blood supply dies. So essentially, by ligating that vessel, you kill the hemorrhoid.
Completely?
Completely. The
Wow.
hemorrhoid is killed. But then a lot of people have this extra tissue. And so the thought is that what do we do with that extra tissue? Well, we sew it up inside you so that it is absorbed in the rectum naturally rather than have to be cut out. And that's the beauty of this procedure, and the rectal mucosal pexy. And so the thought is that we don't have to do a bunch of cutting. We just basically kill the hemorrhoid, take the blood supply, and then sew up that extra tissue. There is not one incision I make for this procedure. It's an incisionless procedure.
If you cut off the blood vessel, I mean, there's no chance that it could grow back.
Our recurrence rate is less than 2%.
Oh, wow, it's amazing.
Well, let's talk about if people don't seek help for hemorrhoids. I know very painful, but what are some of the other complications, problems that occur with these?
Sure. So ongoing prolapse. Prolapse is a condition where the hemorrhoids get inflamed and then come outside the bottom. And so when that happens, it actually is very painful, lots of bleeding. Patients on blood thinners like Coumadin, Plavix, etc., will just actively bleed. It's very painful to sit, take long trips, etc. Also, it's hard to sometimes even have a good bowel movement. And then some people suffer from fecal incontinence, where we basically don't have control of our movement. And so it can be a very serious condition. Also, with a lot of prolapse, you can miss potentially a rectal cancer that is growing inside that people just think, oh, this is a prolapsed hemorrhoid.
That exact same thing
And so
happened to him.
it's a high risk factor for a lot of different things. So if you struggle with hemorrhoids, if you have ongoing bleeding, seek your attention of your doctor.
Sure.
Come visit us. We'll give you some good advice, and take care of you.
Just
A fair
open up
amount of
the lines
patients.
communication.
Yeah, a fair amount of patients qualify for this.
Most patients
Yeah.
actually qualify for this
That's
minimally
great.
invasive
Yeah.
procedure.
That's a good deal. Good thing to know.
Wonderful. Good news. Thanks so much
Absolutely.
for coming on.
Thanks so much.
Good to see you.
Good to
Coming
see you.
up, David Walter with another check of our forecast.
Also, rushed to the hospital after a trip to the laundromat where police pulled a little girl from in Pasadena. It's now 7:47.